I'm sitting here today with Linda, and Linda, you're in from Phoenix, Arizona, and we determined that our first treatment was 4 years ago. You came in and you were having quite a bit of knee pain and left shoulder pain that we determined was primarily from arthritis. And we injected bone marrow stem cells into your knees and your left shoulder, and then we did a repeat treatment a couple of months later, and then we did a third treatment 2.5 years ago. And please tell me a little bit what your pain was like 4 years ago before you came in, and then how you've done these last 4 years.
Okay. Well, by the time I found you, I was diagnosed as a candidate for a knee replacement on my left knee because it had gone to bone on bone. I had had a meniscus tear back in 2003, I think it was 2004, and they had done a meniscus repair where they cut away your cartilage. So as I did all my other activities, that just continued to wear away.
Mm-hmm.
And they don't always tell you those things when they fix one thing. But I was wearing a hinged knee brace, and that was supposed to make it better to get around with until I had the knee replacement, and I didn't want to do that. So then I found you and came in here in September 2012, and that was my first treatment. And so then the first month was a rock and roll after the treatment. It was hills and dales of pain, and then none, and then pain, and then none, and then it kind of subsided, and 60 days later I didn't see as much benefit after the first treatment as I did after the second treatment. And the second treatment didn't have the hills and dales for 3 weeks plus. It was only maybe 2 weeks of it. So the pain level went down, and the movement got better continually, especially after the second treatment, which was 60 days after, roughly. And I no longer wore the hinged knee brace. The pain was extreme before. I couldn't do walking anymore. I couldn't do anything. And after that, I was walking and trying to not necessarily baby it, but having movement and not intense exercises, but mostly walking, swimming, things like that. And it just continued to heal. And before, I used to have a lot of swelling. Anytime I did anything, walk around the store, grocery store, I had swelling all the time. And that all went away. And it just continued to improve. And then, like a couple years ago, I came back for a third treatment. And it's been fabulous. There's no swelling. If I play pickleball or some heavy, intensive, fast movement, I will just put a stretchy knee brace on it just to kind of keep it warm and protect it a little bit, because you do a lot of fast moves, and I'm just scared to ever go back to where I was. But it does wonderful going upstairs. I don't hike as much as I want to, and I'm going to start doing that probably this winter because I live in Phoenix. And that's usually a better time to hike. And but I can't speak highly enough of it, and I tell everybody I know. And
that's great.
I love what's been going on.
Great.
It's not something that is under the drug company's sanctions, because they can't make any money on it. You're using your body to heal your body, and it's wonderful. And to acknowledge that you can actually help your body heal itself is fabulous, and your body wants to heal itself. So this is just giving it the tools.
That's great. Yeah. I'm thrilled for you. So if you had to pick a percentage improvement since 4 years ago, what would you say you've had overall?
I don't think I'm 100% of where I was before all of this occurred, before the pain, before the destruction of the knee and everything else. But I think I'm at least 95%.
Oh,
if
that's
not,
great.
Yeah, I'm
that's
in the high
great.
90s. I can't. I do a lot of different things and it doesn't swell anymore, and it might be a little achy, but I haven't done so the rest of the muscles in the body because I haven't done anything like it. So
great, that's great. And today we're going to do something different. We're going to treat your thumbs.
yes.
Super. I'm thrilled for you. Thanks so much.
Thank you.